Since 1980, the fertility rate for men younger than 30 has decreased by 15%, and age-related infertility is continuing to be a problem. There's also evidence to suggest that testosterone levels are also dropping. The heat generated from laptops can impact sperm production and development, making it difficult to conceive. Simply placing laptops on a table to keep the computer's heat from damaging the sperm and decreasing sperm count and motility can dramatically help. According to a study published in the journal Fertility and Sterility, men who put their cell phones in their pockets or clip them to their belts while using an earpiece to talk risk damaging their sperm. This is because cell phones emit radio frequency electromagnetic waves when they're in talk mode, and that causes higher levels of free radicals in sperm and a reduction in the sperm health. Medication for depression, blood pressure, and certain heart conditions can lower libido and cause impotence. You could check out my videos on the natural treatment for mental health conditions, on normalizing neurotransmitter production, on treating high blood pressure, and on herbs and supplements for increasing testosterone naturally for more information on this. Research from the National Institute of Environmental Health Services, one of the National Institutes of Health, has also shown that keeping your weight under control is a way that men can take charge of their own health and their fertility. The study found that overweight men with a body mass index, a BMI, of over 30 were significantly more likely to be infertile than normal weight men. You could check out my series of videos on weight loss for more advice about lowering your BMI safely. Some things that you can do to help improve your fertility are avoiding hot tubs, wear boxer shorts instead of tight briefs, avoid exercise that can generate heat or trauma to the genital area, eat a nutritious diet, take multivitamins, get 8 hours of sleep per night, stay hydrated and limit caffeine to no more than 2 cups per day. Don't smoke, avoid drugs and excessive alcohol use, minimize exposure to toxins, and practice stress reduction techniques like yoga. You can encounter many toxins in your diet. You should eat an organic diet to help reduce the toxic load. Studies have shown that pesticides can impair the fertility of male frogs, and also genetically modified organism pesticides are linked to birth defects, disruption of male hormones, and cancer. Men who eat soy tend to have lower sperm concentrations than men who eat no soy at all. This is especially true for overweight and obese men who consume soy. It's been reported that bisphenol A has adverse effects on male reproductive systems, including decreased sperm count, abnormal sperm motility, and reduced reproductive organ weight. One way to help avoid bisphenol A is to use glass bottles instead of plastic drinking bottles. Celiac disease is a condition where the lining of the small intestine becomes damaged due to wheat sensitivity. The fine lining, or the villi, in the small intestine is responsible for absorbing vital nutrients from the food that you eat. And when they become damaged, it can cause a wide variety of medical problems, including rashes, IBS, malnutrition, and much more. It might be hard to imagine that celiac disease could have any relation to infertility, but some research is beginning to point in that direction. A number of studies on male infertility was reviewed by researchers in New Zealand, and this was reported in the Cochrane database of systematic reviews. The review focused on 34 controlled trials, involving couples undergoing assisted reproductive techniques, such as in vitro fertilization and sperm injections. Most men in the trials had low sperm counts or low sperm motility, and they were classified as subfertile, that being those that were below average fertility but who were still able to father a child. The review found that those who took antioxidants had 4 times a greater chance to get their partners pregnant than subfertile men who didn't take any antioxidant supplements at all. You could check out my other video on antioxidants for more information about this. A Brazilian study showed that whole grains and eating more fresh fruit was responsible for increased sperm count and viability, and it also played a role in the sperm speed. You should try to consume a low glycemic index diet to help control blood sugar for best results, and also ensure that you consume adequate protein and cholesterol. According to research conducted at the University of Delaware, eating walnuts may help to strengthen fertility in men. Because of the unique makeup of polyunsaturated fats, walnuts are unique in reducing sperm cell damage caused by lipid peroxidation. They are the only tree nut predominantly containing these polyunsaturated fats, making them the best aid in replenishing the damaged cells. New research looking at what appears to be a major contributor to male infertility found that aluminium has powerful implications for safety. Researchers from both the UK and France found that higher levels of aluminium inside a man's body lower the sperm count and the quality of the semen. You could check out my video on mercury dental amalgam fillings to learn about natural ways to detoxify heavy metals. A systematic review supports the claim that supplementing with omega-3 fatty acids may treat male infertility. The review, which was published in the Journal of Dietary Supplements, found that omega-3 fatty acids can significantly improve sperm motility and concentrations of DHA in seminal plasma in infertile men. Typical doses of omega-3 range from 3 up to 9 grams per day of an EPA DHA molecularly distilled fish oil blend. Experimental studies support a beneficial effect of vitamin D on male fertility by modulating hormone production through genomic and non-genomic actions, and particularly by improving semen quality, essentially through non-genomic actions. You want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. It turns out that vitamin K2 is also an essential nutrient for women and men in their reproductive years. Current research shows that vitamin K2 is important for the treatment of polycystic ovarian syndrome, low sperm count, and prenatal development. Initial animal studies have also shown that vitamin K2 improves testosterone production. What does this mean for male fertility? For men, vitamin K2 supplementation may lead to improved sperm counts and to other functional measurements of sperm. As male sperm count has been dropping precipitously since the beginning of the previous century, this may be an important vitamin for male partners if they're trying to conceive. Typical doses range from 100 to 300 micrograms per day of vitamin K2, taken in the form of MK7 for best absorption. It was labelled Activator X by Dr. Weston Price for its many benefits to health and longevity. There's some evidence to suggest that vitamin C supplements can improve semen quality. A study in infertile men showed that taking 1000 milligrams of vitamin C twice per day for up to 2 months increase sperm motility by 92% and sperm count by more than 100%. Getting enough zinc is one of the cornerstones of male fertility. Observational studies show that low zinc status or a deficiency is associated with low testosterone levels, poor sperm quality, and an increased risk of male infertility. Many forms of zinc have low bioavailability. Therefore, a highly absorbable dosed form of zinc would be recommended. Also, the bioflavonoid quercetin, found in things like elderberry juice, has been shown to increase the absorption of zinc and vitamin C. Selenium is a trace mineral and it functions as an antioxidant. Selenium supplements have been shown to increase sperm motility, and a combination of selenium and vitamin E has also been shown to decrease damage from free radicals and improve sperm motility in infertile men. If you have any toxicity, such as mercury amalgam tooth fillings, you can be deficient in selenium. This is because selenium is required for the production of glutathione, the body's master antioxidant and detoxifier. You can get your daily dose of 200 micrograms of selenium from consuming 3 Brazil nuts per day. Boron has been defined as a possible essential trace element for humans by the World Health Organization. Dietary boron supplementation was shown to increase the sperm output, sperm motility, and it enhanced the immune and the antioxidant defense capacity in male goats. The herb Tribulus terrestris enhances male fertility by increasing sperm count, viability, and libido. The herb astragalus has been investigated for its effect on lengthening telomeres, which would have life extension possibilities. It's also been shown to increase the motility of sperm in the semen. One study in 75 male partners of couples with infertility found that taking 200 milligrams of Tongkat Ali extract per day significantly improved sperm concentration and motility after 3 months of use. The treatment helped over 14% of the couples to become pregnant. This herb is also known as Indonesian ginseng for its many benefits, boosting vitality, endurance, motivation, and muscle growth in men, as well as increasing sex drive. A new study suggests that stress can reduce sperm and semen quality, and this could have implications for male fertility. According to the American Society of Reproductive Medicine, in around 40% of infertile couples, the male partner is the sole cause or contributing cause of the infertility. This is logical. Just like in women, stress uses the body's pregnenolone to create cortisol stress hormone. When this happens, there's insufficient pregnenolone left over to be converted into DHEA, testosterone, and estrogen. The herb Rhodiola rosea helps the body react to stress and anxiety in the best way possible, while nourishing the adrenal glands. Better resistance to stress helps to build strong, healthy sperm and to correct decreased libido. Other ways to help control cortisol stress hormone are Tulsi tea, which is also known as holy basil tea, and the supplement phosphodietyl-serine, taken at doses of 600 to 800 milligrams per day. Vitex agnus, or the chasteberry. Prolactin is released with stress. It contributes to lower levels of androgens, testosterones, and suppresses libido. and that's how Vitex improves libido, by dropping off prolactin, increasing luteinizing hormone, and luteinizing hormone in men stimulates the production of testosterone. Dopamine has been found in both semen and oviductal fluid, and dopamine receptors have been detected in male genital tracts and spermatozoa, suggesting that the dopamine system may control important reproductive functions in humans. A dopamine agonist is often used to restore fertility in men who've had their natural hormone production interfered with by abusing anabolic steroids. The previously mentioned herb, chasteberry, has dopaminergic activity. You could check out my video, Know Your Neurotransmitters, Dopamine, for more information on balancing dopamine levels naturally. Folic acid is a B vitamin that's necessary for DNA synthesis. Low levels of folic acid have been associated with a decreased sperm count and decreased sperm motility. In a recent study, the combination of zinc and folic acid results in a 75% increase in total normal sperm count in subfertile men. The best form of folic acid is a 5-methyl tetrahydrofolate. If you have an MTHFR gene polymorphism, you'll require higher doses of B vitamins in order to prevent physical and mental health issues. You can check out a questionnaire on under and over methylation in order to determine if you're likely undermethylated and require this higher dose of B vitamins and sulfurous compounds like MSM, trimethylglycine, and D-L-methionine in order to prevent the toxic effects of homocysteine on the body. Taurine, the amino acid, has been shown to have a positive impact on sperm health and male fertility. It functions to increase overall sperm quality, including sperm count, motility, and shape. Typical doses are 1 gram taken 3 times per day. Sperm require a great deal of adenosine triphosphate for the flagellum to move around in the early phase of fertilization. It's generally accepted that there's between 70 to 80 mitochondria in the midpiece of mammalian sperm. It's long established that there is 1 copy of the mitochondrial DNA in each mitochondrion in the midpiece of these mammalian sperm. You can check out my other video on boosting your mitochondrial function for natural treatments such as CoQ10, D-ribose, PQQ, cold water exposure, and the research chemical SR9009 as all possible ways to enhance mitochondrial function and boost adenosine triphosphate. A number of studies have found that CoQ10 fights against oxidative damage, for example, improving sperm quality in the process. Interestingly, studies indicate that supplementing with CoQ10 can also reverse age-related decline in the quality and the quantity of eggs in women trying to conceive. The best form of the CoQ10 is ubiquinol, with doses ranging from 1 to 400 milligrams per day. Autoimmune disease and infertility can result in difficulty conceiving. Having any autoimmune disease generally increases your risk of infertility. You can check out my other videos on autoimmune diseases, on antioxidants, and on inflammation, as there can be a link here between all these and infertility. This is because the autoimmune can be caused by excessive inflammation due to increased oxidation from a lack of sufficient antioxidants in the diet. Ginseng enhances sexual performance, improves male fertility through modulating the neuronal and hormonal systems, promotes spermatogenesis, and acts directly on sperm via steroid receptors. Ginseng also preserves male fertility during disease states. Panax ginseng is one of the most prescribed and highly sought after herbs used in traditional Chinese medicine. The herb ashwagandha may help to boost fertility and promote reproductive health, especially in men. In one 3-month study involving 75 men experiencing infertility, 5 grams of ashwagandha daily increased the sperm count and the motility. Studies have shown that men who sleep for less than 6 hours a night are 31% less likely to impregnate a woman than those who get between 7 and 8 hours sleep. Men produce testosterone, which is the prominent hormone in sperm production, while they sleep, so sleeping too little reduces the release of testosterone. You can check out my video on herbs to help you sleep for more information about this, and my other video on herbs to help boost testosterone production. Researchers found that weightlifting, running, and jogging were all associated with higher sperm concentrations when compared to other types of exercise like walking and aerobics. However, over-exercising, for example, more than 1 hour per day, can cause excessive inflammation, exhaustion, nutrient deficiencies, and increased stress, which can all negatively affect fertility. Cholesterol is the precursor of steroid synthesis, so it's crucial for normal sperm production. Lots of experimental and clinical data has highlighted the importance of lipid metabolism in the control of testicular physiology and in male fertility. As sex hormones are synthesized from cholesterol, too low a body fat can cause problems. High cholesterol can also negatively affect fertility. For example, couples with the highest cholesterol took the longest to achieve pregnancy. One factor that leads to bad cholesterol increasing is inflammation from a high carbohydrate diet, high sugar diet example. Therefore, a low GI diet would be advised. You can check out my other videos on cholesterol for more information on ways to help control this. L-carnitine is necessary to shuttle fatty acids across the cell's mitochondrial membrane. The mitochondria are responsible for creating, sustaining, and managing cellular energy. The mitochondria use fatty acids to burn as fuel for creating cellular energy, which is also known as ATP. Being that the body is made up of cells, L-carnitine is very important to energy, stamina, and cellular formation. Also, it's considered a potent antioxidant, and L-carnitine has been reported to increase sperm health by providing the protection that the body needs to counteract free radical damage. Sperm cells are highly susceptible to damage from free radicals. Antioxidants protect this cellular health, including the health of a man's sperm and the DNA contained within each sperm. Typical doses of L-carnitine are 1,000 milligrams, taken 2 to 3 times per day, in the form of acetyl L-carnitine. If left untreated, an underactive thyroid can lead to male infertility. Studies show that low thyroid hormone level in men can cause poor semen quality, low sperm count, reduced testicular function, erectile dysfunction, and also a drop in libido. You could check out my other video on hypothyroidism for more information about treating this condition with supplements like selenium, tyrosine, and nascent iodine. It's interesting to note that nascent iodine is required by the body for the synthesis of sex and stress hormones.